Tonight.
Hi guys, this is Dr. Shiraz Farooq, board certified colorectal surgeon, and my spouse, Sydney Farooq.
Hey, good evening.
Good evening guys, we are at Colwell, America. We're doing the DaBootyDoc Talk. Sydney is also wearing the DaBootyDoc Talk
today. I match. So today's our episode 25. If you haven't joined us before, why not? Where you been? Just kidding. So we're doing in Colwell, America's headquarters in Tampa, Florida. Our episode number 25. It's about rubber band ligation today.
Yes, guys, we're talking about hemorrhoids and how do we treat them. And I think rubber band ligation is the gold standard for that. So we thought we'll talk a little bit about how to treat hemorrhoids and what is the best option for most of the hemorrhoidal problems. As you know, the DaBootyDoc Talk is a educational
talk show
that we have going on in Tampa, Florida.
So we want to have easygoing conversation with a little bit of humor involved, not specifically medical advice, but to give you an idea from a doctor's perspective, what types of treatments are out there, what you can do to help yourself.
And if you find yourself in trouble, then you can seek medical help. So, you know, this is to guide you in the right direction.
That's right.
So hopefully all of you guys have enjoyed the weekend. It's coming up again. We had a holiday, so it seems like a short week, and we're back at it. So excited to be back at the talk show with our topic today. For the people who are joining in, this is the DaBootyDoc Talk, and we are talking about hemorrhoidal treatment and rubber band ligation.
Yes, specifically rubber band ligation, which is also known as RBL, you might have heard.
Correct. So guys, everybody asks me, what are hemorrhoids? Do you guys know what hemorrhoids are?
If you've seen our talk show before.
Yes, we actually gave a 30-minute talk on hemorrhoids in the past, and we were able to discuss what hemorrhoids are and what those things are. So you can go back on the YouTube channel for the DaBootyDoc Talk and find that out, or we can give you some information today.
So to kind of brief you today, if you want more in-depth, he's saying go back and check our other previous episodes, but simply, what are hemorrhoids, Doc?
Hemorrhoids are a sac of veins that are hanging around the anus, around the bottom, that sometimes swell up and can cause various symptoms. And these can range from itching, burning, rectal pain, bleeding, discomfort, or prolapsed symptoms of being uncomfortable and having tissue hanging out.
So is a hemorrhoid actually a vein then, specifically, that's being affected in your rectum or anus?
So for the layman person, hemorrhoid can be called a vein, but it's actually a combination of arteries and veins, or smaller blood vessels. And these blood vessels have both oxygenated and deoxygenated blood, so that's why it looks bright red to some of the patients that are out there. It can be also dark blood. You can also get blood clots. So anytime you see red blood, everybody thinks that they have a hemorrhoid, and everything in the bottom is a roid till proven otherwise.
Which it is one of the most.
Do you know instead of hemorrhoids, they should have been called asteroids?
This is a fact, actually.
You know, asteroids would have been a better name for hemorrhoids.
I think that's a cuss word.
No, asteroids, like the NASA asteroids, guys. Do you guys know that right now we are tracking 4 asteroids that are about to go past the world, the globe, the planet?
Real asteroids, not hemorrhoids.
Not hemorrhoids. So
Space
there's a lot of... I was watching the TV today while I was waiting to operate, and they were talking about NASA and how these asteroids are, and I was thinking about hemorrhoids. You know how it goes.
So keep your eyes on the asteroids in the sky and in your bottom too.
Yes. So hemorrhoids are not asteroids. Hemorrhoids are blood vessels that can become achy, can become painful, and these swollen bunch of hemorrhoids, blood vessels, can cause discomfort and problems. And that's why people come and see doctors and proctologists and gastroenterologists for that.
So if you're searching for treatments for hemorrhoids, you might find commonly listed rubber band ligation, because like Dr. Farooq said, it's one of the gold standards. So it's something that is very highly acclaimed to be used as a treatment modality and to have successful outcomes as well. So we want to specifically focus on rubber band ligation, but firstly, what are out there?
So hemorrhoids can be basically divided into internal hemorrhoids and external hemorrhoids. Because when you're talking about treatment for these hemorrhoids, you need to define where the hemorrhoid is present. Is it in outer space as an asteroid, or is it in your bottom? So if it's in your bottom, if it's hanging outside and is not inside, then it's called an external hemorrhoid.
Makes sense.
If it's inside, you may not see it, or it may slide in and out, and then it's called an internal hemorrhoid. Internal hemorrhoids further are classified in grades, and the grades are grade 1, grade 2, grade 3, and grade 4. We also classify them as good, bad, the ugly, and the very, very ugly. Okay, so hemorrhoids that are grade 4 are the worst, and hemorrhoids that are grade 1 are the least problematic. So when you're talking about treatment for hemorrhoids, you need to define, are these external hemorrhoids? And if they are external hemorrhoids, then the treatment is different than the internal hemorrhoids. And if they are internal hemorrhoids, then you need to classify them into grades, because each grade of hemorrhoid has a different treatment plan. So for grades that are easy, that are grade 1 and 2 and 3, these can be treated with multiple non-operative treatments. Rubber band ligation can be used from grade 1 to 4. Most commonly is used for grade 1 and 2, where you have hemorrhoids that bleed and sometimes they come out. Grade 4 hemorrhoids are always out, and grade 1 hemorrhoids are inside, if that helps some people understand the grades.
Right. So different treatment options for different types of hemorrhoids.
Correct. When you're talking about hemorrhoidal treatment, non-invasive treatments are very helpful for patients. Nobody wants to have something shoved up their butt, and if they do, they want it out immediately. So it's a no-go state. You know, a lot of people tell me it's a exit only, and I understand that, and we try to help our patients go through the whole fear of having to come to a proctologist. It's a very scary thing for some patients.
Certainly.
When you talk about treatment, non-invasive and operative treatment are two big buckets that we'll be dividing them into. So one option is surgery, which is an invasive treatment. Another option is non-operative treatment, which we also call medical treatment or non-surgical treatment. First of all, for all hemorrhoids, do you know what you have to do?
Stop the bleeding.
Stop the bleeding, and you have to change their diet, and you have to improve the causes why this is happening. So hemorrhoidal physiology is such that hemorrhoids are caused when there is a pushing or like a strain on the anus. So its mechanics is that prolapse of the hemorrhoids happens when you push, when you squeeze, when you have diarrhea, when you have constipation. Also, people who are, women who are pregnant can develop hemorrhoids, people who do heavy lifting, people who sit for a long time or stand for a long time. So drivers and policemen who are always standing can be affected. So these are some of the things that you have to consider when you're talking about treatment for patients.
So define what maybe lifestyle habits are causing hemorrhoidal issues, and then focusing the treatment plan around that.
Correct. So this is a good question, guys. Lifestyle habits are very important. What we do to our bodies is important. So if you're eating better food, adding more fiber, then your bowel movements are going to come out easily. As you know, hemorrhoids are the gatekeeper of the anus, and they help to close the anus and keep it closed. So if hemorrhoids are very big, they can cause pressure symptoms in that area and discomfort. So we want our patients to be able to eat lots of fiber. Fiber helps to make everything go, and along with that, activity, a good sleep, exercise, not smoking a lot, because coughing will make the hemorrhoids worse because of the pressure that we have. So all of those choices will help the treatment. And as such, the treatment can then be divided into medical and non-medical or surgical treatment.
Meaning surgical or non-surgical.
Correct.
So for rubber band ligation, that falls under the non-surgical treatment option.
So non-surgical treatment options are basically, you will start with diet changes. Then you can improve your bowel function by adding fiber, or if you're constipated, sometimes stool softeners can be used. You can also use some medicines to shrink the hemorrhoids, or use a suppository or a cream or an emollient to make the area softer, easier, and make the bowel movement come out easy. If there's pain, numbing medicines can work. There are some herbal medicines and real medicines, pharmaceutical medicines that can shrink the hemorrhoids. So that can decrease the swelling and pain in that area. So after you've exhausted those things, and if the hemorrhoids are not better, and you're still bleeding and having pain and discomfort, then you will seek help from a doctor.
Will hemorrhoids end up going away on their own, or what happens if I change my lifestyle habits, but I still have hemorrhoids, or do I have hope of them going away on their own?
Hemorrhoids probably will not go away if they're grade 2 and above. So if they're grade 2 and above, that means that your body has been used to pushing and straining, and there's prolapse of these loose tissue, and they're coming out. So at that point, you can do various things to make the swelling go away. Rubber band ligation is basically a procedure where we can put a rubber band around the hemorrhoid, and that causes castration or lack of blood flow to the area, and the hemorrhoid then falls off. Does that make sense? You understand what I'm saying? Does that easy for the layperson?
And let's paint a picture. So are we Bob Ross moment? How are we putting our rubber bands on there? I mean, is this done with tools?
So before you go and try to do a rubber band on yourself, you need to understand that in order to have a rubber band ligation treatment, you will have to seek medical help. So you will have to go and talk to a doctor who is a specialist in this area, DaBootyDoc. Okay. In our case, colorectal surgeons are the experts, proctologists who deal with anorectal problems. Some gastroenterologists also do that. Some general surgeons also do that. Some primary care doctors also do that. And sometimes nurse practitioners can also help. So hemorrhoidal treatment involves decreasing the blood flow to that area which is swollen, inflamed, and angry. And rubber band ligation is a mechanical method where you are actually stopping the blood flow to the hemorrhoid, and the hemorrhoid is going to be, how should I say, what's another word for ligation, where you tie off the blood flow to an area?
Or like suffocating it. Like
suffocating.
If you, I always think of like if
or
you have
squeezing it tight and nothing goes through.
floss wrapped around your fingertip really tight. When you're flossing your teeth, all of a sudden your fingertip starts turning purple. Looks similar idea there. The band creates the lack of supply of the blood to the rest of the hemorrhoid, so whatever's beyond that rubber band will shrivel up and fall off.
So what happens is that you go there and you are going to see a doctor who's going to do a physical examination, put you on the side or on your stomach, and do what's called a anoscopy. Anoscopy is a test where we pass a device that goes inside the anus, may have a light on it, sometimes has a camera also, and then you can see inside. So you're looking through a small scope inside the anus, and if you see hemorrhoidal bleeding or swelling, then you can grasp it or use a suction device to hold on to it. And then there's there are many specialized devices, by the way. There are plastic ones, there are metallic ones, there are suction devices, there are clips, there are rubber bands. You don't actually tie those off over there. So you can use these mechanical devices, and you can put a rubber band or a clip on the hemorrhoid that causes it to shrivel up and fall off in a couple of days. And what happens with rubber banding is that this procedure is done in office. It's elective, it's very quick, doesn't cause a lot of pain, and you can do one hemorrhoid at a time. If you do more than one hemorrhoid, you can get a lot of pain and trouble. So we try to do one side at a time. And then we come back in a couple of weeks, look at that area where the hemorrhoid fell off, and go to the other area where if there's another hemorrhoid, we can do the same treatment or some other treatment.
So with rubber band ligation in particular, that's referring to using the banding method with a rubber band.
Correct. So rubber band ligation has a very good success rate, has a success rate about up to 97%. In some literature, meta-analysis goes up to 84%. What that means is that it's a very successful procedure. When you put the band on, more than likely the band is going to cause the hemorrhoidal swelling to go down. The area that the band is on will have low blood flow or no blood flow and will fall off. And when it falls off, the area will scar in and heal.
Will you be able to see where a hemorrhoid was banded? So if I came back for follow-up?
You can, the doctor can, but the patient cannot see it. They can sometimes see the hemorrhoid fall off in the bathroom. They may see a rubber band. Some patients have some bleeding afterwards. And, you can have bleeding about the third day to the fifth day. These procedures are not so complicated. The complication rate is very less or small, so that can help.
So to kind of recap, rubber band ligation is only for internal hemorrhoids.
Correct.
So there's a variety of grades of internal hemorrhoids. And can banding work on all grades, or?
It works usually on grade 1 to 3 the most. Grade 4 hemorrhoids, which are very large and out, you may require surgical treatment for those.
And if I'm not incorrect, hemorrhoids that are grade 3 sometimes and 4 usually prolapsing.
Prolapsing hemorrhoids.
So they're external as well.
They can become external and come out, and you can see the swollen, angry hemorrhoids that look like red berries.
And likely that's not a hemorrhoid that you're going to want to do a banding procedure on.
Sometimes you can, depending on what the patient's needs are. If the patient is not so healthy, if they have other medical problems, you have to vary all these symptoms and see where they land on the spectrum of treatment.
And then if you are getting banding done, it's done in a clinical setting.
In a clinical setting,
you have to have that consultation first.
Correct.
So usually you don't just like pop into a doctor's office and say, hey, I'm here for rubber banding. You gotta be examined with the endoscopy, get a treatment plan, and typically one hemorrhoid is treated at a time.
So you may sometimes up to 10 to 12 treatments may be required in some patients. Usually most patients only require 3 to 6 treatments over a course of 6 to 8 weeks.
Mm-hmm.
So we're able to handle a lot of our patients in the office, and this can prevent hemorrhoids from getting worse. So if you have earlier symptoms and your hemorrhoids are starting to bleed, please don't wait. Don't suffer in silence or be quiet about it, be ashamed about it. Go seek medical help.
Yeah, absolutely. You don't want to be bleeding every time you use the bathroom and wondering why and not having answers. So it's important that you seek help. And then during your visits, every time you have a rubber band, you should be improving in between visits. Correct. Too.
And that is important. In between, Diet is very important, guys. These lifestyle changes that we talked about, avoid excessive pushing and straining, improve your diet with fiber. I talk about ground flaxseed all the time. That's a very good soluble and insoluble fiber that you can add. Magic pixie dust. That can help your diet improve. Drink lots of liquids, fluids. That will make your bowel movements better and you'll stay hydrated. And sometimes medicines can be used also to improve that.
So after your procedure, usually people have more than one hemorrhoid.
Correct.
And they're in different locations in your rectum and they're treated one at a time. So we usually recommend starting with the worst first, because every time you treat a hemorrhoid with rubber band ligation, it's going to reduce the inflammation and the other hemorrhoids to likely reduce some of their irritation some as well. So you want
to get the bad guy first so that we can, clear the field.
But you might not have any pain or sensation. You may have some pain that can be treated with over-the-counter pain medication like ibuprofen. Might be like cramping in that area or like the urge to use the restroom, which we say if you feel like you have to go but it's not coming, don't go after your banding treatment sitting on the toilet trying to push and get something out. So
Correct.
It's likely a symptom of the banding procedure.
It's also called the gold standard because rubber band ligation has been found to be superior than other non-invasive treatments. Sometimes we can inject an agent or a chemical inside the hemorrhoid that causes the blood flow to decrease. We can also use a infrared probe, not a laser, but an infrared probe that can burn the hemorrhoid and cause cauterization. So in the days of Aristotle, this is true. I wasn't there, but I've read about that. Yes, I could be there. That they used to use hot pokers, and a hot poker could be touched to the hemorrhoid to make the swelling go down and cause cauterization. So hemorrhoids have been around forever. Human beings have been dealing with this problem. So cutting it out or burning it or putting a chemical agent on it has been used for a long time.
But why would you want to do all of those things if you can just simply put a rubber band on it, let it shrivel up and fall off in a couple of days? So
yes, it's a very convenient, very easy and procedure that has a lot of benefits. The downside is very little. Most patients have less than 5% or less problems. The recurrence rate is less than 5%. Complications are very few for most of the patients, and it's very well tolerated.
Yeah. So now you've heard about it. Now you're interested in it. It doesn't mean that you're a candidate though. So some patients, like we were saying, like grade 4 internal hemorrhoids, maybe they're not bandable, and any external hemorrhoid is not bandable. So
and why is that? Because the external hemorrhoids have nerve endings. So if you try to band external hemorrhoid, you're going to cause severe pain and swelling. So internal hemorrhoids are above the area inside where there's no sensation or very little sensation.
So there's less nerve endings. That's why it's not, you don't have as many nerve endings in that area of your body.
Correct. So around the anus, which is very sensitive, on the outside, if there's a swelling, more than likely it's an external hemorrhoid. And internal hemorrhoids are the only ones that are treated with rubber band ligation. External hemorrhoids are not treated with rubber band ligation.
Right. So trust your doctor. Go seek treatment. Find out what plan is best for you. Maybe they don't offer rubber band ligation, so you could find a doctor who does. Or maybe they are recommending more surgical treatment options versus banding or other types of non-invasive procedures.
There are many treatment options, and these treatment options are important. Also, prevention is important. I talk about it all the time, talking about it again. Prevent things from happening to your bottom, guys. Eat better food, eat more fiber.
Yeah.
That's important.
And even though recurrence rate is low, you still want to maintain those healthy lifestyle habits that are going to prevent you from getting more hemorrhoids, because sometimes we see patients and 6 months later they have a hemorrhoid again after their full treatment. They had 3 bandings done, their bleeding stopped, then it comes back again. So
and a lot of times when you ask them, they're like, oh doc, I stopped eating more fiber, I don't exercise, I don't drink lots of fluids.
Or maybe they're
obese,
at the
or
gym
yeah.
every day, beast mode, or they didn't get that nice cushy pillow to sit on during their trekking route or whatever. So you have to make life changes too. Don't expect a cure-all. It might be a simple procedure, but it costs money, it takes up your time, and it's something that you have to maintain.
Correct. It's your butt we're talking about, guys. The Booty Dog Talk. We are here for your tush. Okay, and the tushy is very important. If we can protect the booty, we are going to be okay.
Right.
And what I mean by that is that your digestive system, your colon, your rectum, your small intestine, your mouth, your esophagus, food pipe, all of that, we are eating constantly, drinking all the time. So if we know what we're eating and drinking, and if we put good stuff into our mouth, then our bottom and our exit is going to be okay also.
Yeah, so don't expect magic. If you have hemorrhoidal issues, then you have to treat them and you have to be mindful of them too. Now, we didn't talk much about risks or complications. Is there anything that you need to worry about? Sounds pretty simple.
So it's a relatively benign procedure. You're undergoing it without anesthesia, mostly in a doctor's office. You come in and a scope is passed in. There's some discomfort. The hemorrhoidal banding shouldn't cause a lot of pain. You go home, you can get some bleeding. Sometimes problems with urination can happen. Sometimes patients can have pain, severe infection, and things like when you can pass out or have night sweats and stuff is very, very rare. So we like to tell patients that this is very safe for you mostly, and if done right, it can have great outcomes.
So if you notice bleeding after your procedure, that could be common. If you have some pain that's not very, very severe, that could be common. But from time to time, you might need a follow-up appointment if you are having very severe pain afterwards, or infection can occur if it wasn't treated right.
And rubberband ligation is not the only treatment, guys. There are other treatments that are available, and there are multiple tools in the box. So if you have seen a doctor and you've been told that you need surgery, then that means that your hemorrhoids are bigger than what rubberband ligation can handle. And at that time, you might have to go on the chopping block and chop.
Mm-hmm.
You know, so before you get there, make sure that you're taking care of your health, eating better food. Again, I emphasize this, but I think I've said it 3 to 5 times during this talk. Fiber and hydration, very important.
Drink more water. Yes.
Yes.
So good luck to you out there if you are dealing with this issue, but know that there are some easy treatments. Patients are very satisfied with rubber band ligation. It definitely works, and by the end of your treatment, usually there's little to no bleeding at all, and you can move on with your life.
Yes. You know, this is one of these treatments that can really make a difference in your life if you have hemorrhoidal problems, because a lot of us don't seek help. And if you do, you'll find that we can get you better very fast.
And if you get help early on, then your treatment options are less invasive. So you can do things like rubber band ligation.
Correct. Don't wait too long.
Yeah.
You know, you might end up having worse problems. So getting medical help early is very important, I think.
Yeah, and hemorrhoids are very common. So I bet you're not the only one.
And so are asteroids. They're all around in the solar system.
So keep an eye out for those 4 of them right now, I hear.
Correct.
They're
So
coming
guys,
for you.
we are very happy to be here. Our time is going to be up soon.
Yeah.
This is a 30-minute show, DaBootyDoc Talk, with Dr. Shiraz Farooq, board-certified colorectal surgeon, and Sydney Farooq, my spouse. We are here in Tampa, Florida, and we appreciate that you guys have taken your time to watch this.
Yeah.
Hopefully this will help somebody. We're putting the magic out in the air.
So save the show, send it to your friends, leave us comments if you have topics that you want to hear about. We're interested in top to bottom. So we've got your GI tract covered and your digestive health. So see us every Thursday at 7 o'clock. We'll be here next week too. Thanks for your time today.
At the Booty Doc Talk, Sydney and Shiraz signing out.
Bye.
Thank you guys.
Have a good night, everyone.
Bye-bye. Goodbye.